This is a teaching video for the use of personal protective equipment when caring for patients with confirmed or suspected COVID-19. The population that I'm teaching is healthcare providers that are caring for suspected or confirmed COVID-19 patients, and the learning style is active learning style. I'll be teaching Caitlin. And Caitlin, we're gonna go ahead and just get your consent. Am I okay to use you in this video?
Yes.
Okay. And so first things first, we're gonna gather the equipment. What do we have here?
We have hand sanitizer, isolation gowns, a face shield, a mask, and gloves.
Sounds good. And going off of the CDC guidelines, our first step is going to be hand hygiene, please. Next step will be to go ahead and don the gown. Next step will be to go ahead and put on your mask. Notice how she's touching the outside of the mask. The inside of the mask will be going on her face, although her hands are clean. Next step, we'll be going to go ahead and put on the face shield or goggles. In this case, she has a face shield that serves as an eye shield as well. As we know, COVID-19 is a droplet precaution, thus wearing the surgical mask is suitable for this isolation. And she will perform hand hygiene according to the CDC one last time, noted in number 6 there, before she places on her gloves. Now that Caitlin has properly donned the PPE, she's able to enter a patient room. Now, let's say Caitlin has now provided patient care. She has now the task of doffing the PPE. Her first step is to remove the gloves and place them in a receptacle while inside the room. Next step is to remove the gown, according to the CDC. Healthcare provider may now perform hand hygiene. Next step, according to the CDC, is to remove the face shield, and now the next step is to remove or discard the face mask. And lastly, perform hand hygiene before exiting patient room. Thank you, Caitlin.